My name is Jeffrey Allen. I'm a neurologist and neuromuscular specialist at the University of Minnesota. My special interest is taking care of folks with CIDP and related immune-mediated neuropathies. I've been in clinical practice for about 15 years and have spent a lot of time on clinical trials, both designing and conducting those clinical trials. My clinical practice focuses on taking care of patients with CIDP and related neuropathies. And as a clinical scientist, I'm very interested in trying to find better ways to study the disease and treat the disease. In the interest of full disclosure, it's important to know that I'm not an investigator for the ARISE clinical trial, but I am being compensated in order to film this video. So CIDP is an autoimmune disease that attacks the peripheral nerve, and we think that the first part of the nerve that gets attacked is the covering of the nerve called the myelin. Myelin is really important to allow a nerve to transmit an electrical signal down the nerve. So when that part of the nerve gets affected, the nerve starts to fail, which results in the characteristic symptoms that people with CIDP get affected by, including numbness and weakness. Sometimes trials are called phase 1, phase 2, or phase 3 studies. Phase 1 studies tend to enroll a small number of patients and really focus on, is that investigational drug safe? Phase 2 and especially phase 3 studies enroll larger numbers of patients to really not only study, is the drug safe, but also does it work? Is it effective for the disease that we're studying? So this ARISE study is a phase 2-3 study that's sponsored by Johnson & Johnson Innovative Medicine. The investigational compound is one that's administered by an IV infusion, which means through a vein, and during the clinical trial, it's administered every 2 weeks. So what is a clinical trial in general? So high-level overview, clinical trials are scientific evaluations really to understand if an investigational medication or treatment is effective for a disease. Clinical trials really are really important to help clinicians, doctors, and scientists understand if an investigational medication is safe and effective to be used in humans for a given condition. Clinical trials often require a large number of volunteers in order to know if the drug works, and it's important that those volunteers come from a diverse group of people, not just a small segment of patients with the disease. So diversity is really, really important. In order to know if the clinical trial is right for you, it's important to talk to your doctor and ask about any questions or concerns that you have. Some questions that you might want to ask your doctor include, what's the goal of the study? What are the potential benefits of being in this study? Are there any risks to being in this study? What sort of expectations are required of you of being in this study? What will happen if you worsen during the study? And what happens if you change your mind during the study? So the ARISE trial will include adults with CIDP. Like all clinical trials, there's a list of inclusion and exclusion criteria, or eligibility criteria, that everybody needs to fulfill in order to be in the trial. It's important that you talk to your doctor about those eligibility requirements. After the informed consent is complete, then the study activities may begin. There's a number of different phases of the ARISE trial that I think are important to talk about in a little bit of detail. During the screening phase, a thorough medical examination will occur, and your doctor will reassess your diagnosis of CIDP. If your diagnosis is confirmed, then you may be eligible to enter the next phase of the trial. During the run-in phase, if you're taking a treatment for CIDP, your doctor may ask you to suspend or to stop that treatment. The run-in phase lasts for up to 12 weeks. During the open label phase of the trial, everybody that enters that stage will get study investigational compound. That's what open label means. The purpose of the open label study is to understand the number of people that respond to the study medication. The open label phase of this trial lasts for up to 12 weeks. During the double-blind phase of the trial, everybody is randomly assigned to continue to receive the study investigational medication or a placebo. Randomly means it's a flip of the coin, and placebo means that you don't know what you're getting. So you don't know what you're getting, and your doctor doesn't know what you're getting. The last phase of the trial is called the open label extension, and this is an optional phase of the trial. The open label extension lasts between 2 and 5 years. A study doctor will be able to talk to you about the specifics of each phase in more detail, and participation in this trial may be helpful to advance CIDP research and potentially find future new treatments for CIDP. It's really important that you talk to your doctor if any safety concerns come up or if you develop any adverse reactions during the study. Your doctor and study team will try to understand if those adverse events are related to the study investigational compound or if maybe they're related to your CIDP. If your CIDP symptoms do worsen, your study doctor may want to treat you with some standard CIDP treatments. If you're interested in learning more about CIDP trials, I'd encourage you to speak with your providers.